I'm Captain Chad Guidry, Louisiana State Police, Crime Lab Director. And we have a crime lab here that has all the various forensics fields that anybody can imagine. But we have about 148 people under our roof, and we actually got handed a task of creating a sexual assault tracking program for the entire state. That's where these beautiful ladies came into play, where they helped create the program. And we'll just kind of go through our quick little introduction. We have Heather Furness, who's the program manager, and we have Bridget Depew and Carrie Whittington, who's our admin coordinators for the program. Without them, this would not be successful. Also, the partnership with Microsoft and a few other agencies. So we'll kind of go through where we started, how this came to, and then where we at with it. Let's see if I get this right. Let's see. All right, so in 2018, 2019, Louisiana State actually formed a committee to look at the oversight of sexual assault kits. So the sexual assault oversight committee was formed. From there, that's where the push became for somebody to actually manage such a program. It's been a long 2-year process to get this up and running and started. So today we'll cover the concept, where it came from, the stakeholders, internal and external, legislation that started all this, the software, which is really important for us, the implementation, and we'll answer any questions you may have. So the Louisiana State Police, it's not even Louisiana State Police, it's just going to be the Louisiana Sexual Assault Kit Tracking Program. It's an initiative designed to improve the management and tracking of sexual assault kits. So up until this point, for the last 10, 15 years, there's the Louisiana Commission of Law Enforcement. It's a separate entity that was responsible for tracking sexual assault kits just on a survey method on how many were collected, how many were processed. This was done through SurveyMonkey, and there was no mandate to it. So various years would show 200 plus law enforcement agencies of the 400 would respond. Some years it was all 400 and whatever it is that we have in the state. So the numbers were really skewed. And then when I'm looking at what the other labs reported, because there's 6 other labs in the state that processes them, and I see one lab did 2 for the year, I really knew the numbers were skewed off of that. So we start off with who's our external stakeholders. That's every sane or medical facility in the state, all law enforcement, and most importantly, the survivor. In the state, we don't call them victims, they're called survivors. It's because that's what they are because of the traumatic. And then one part we do have is going to be the prosecution. One thing to note, and you'll see this in legislation, is that the prosecutors are not mandated to report to this program right now. We're trying to work on that aspect. For right now, the mandate is for law enforcement, sane personnel, and the crime labs. So we started off with a huge partnership. Besides our crime lab here and the program that runs it, it's going to be our Office of Technology Services as well as Microsoft. It's a huge ordeal to get this to where we at with it. Without the partnerships, that's kind of an internalish partnership with the external of Microsoft. But it was really huge for them to come in and help us out with this program. So as I mentioned earlier, back 2018, 2019, a Sexual Oversight Committee was formed. It's about 18 panel members. And they started looking into the whole aspect of how do they track kits, what is the process, standardizing kits, and how to manage it from there. My predecessor in my position was on the panel that 18 members, and he volunteered, said state police would actually begin that program. Since then, he has left and kind of fell in my shoes here under the crime lab. So 2.5 years ago, we started exploring the process of how do we do this. At the time, I believe it was roughly about 40 states had a program in place. And so we started looking at their policies, procedures, what program software they were using, and who was mandated to use it. So in 2023, Senator Beth Mizell state senator here, she authored a bill to actually put this into place. She is one of the original 18 members of that committee. She authored a bill and specifically said the state police would manage and implement the program. And that's where it took off from there for us. Initially, we had just myself and Heather working here, working on the project. And it was going out and just again reaching out to all the different states and seeing what their programs were about and then drafting something for ourselves personally. When it did go to session, it was passed unopposed. And then it brought in probably about 45 co-authors to it, which is really phenomenal. So we did face a whole bunch of challenges when it came to this because of the timeline that was given to us. So this was passed in our regular session in 2023, which started our new fiscal year, July 1. And then from July 1 to 2023 to July 1, 2024 is our timeline to get it started. So we had 1 year. And we had a whole bunch of challenges. One was personnel. We couldn't do it by ourselves. So that's why we were able to get Bridget and Carrie on board, which was, again, phenomenal teamwork and partnerships there. Second piece was software, and we'll get to that in a few seconds. The kits, we had to standardize the kits. So we had to go in front of this oversight committee to get this standardized. The committee finally approved one single kit versus two separate kits, one's for juveniles, one's for adults. So now we have one standardized kit that we issue out across the state, and any sane personnel, which is a sexual assault nurse examiner, they actually have to order the kits from us, and then we take and supply them because there's a unique tracking number to them all. Again, I mentioned the timeline. That 1 year timeline was really huge, and that's going to come and play with the software issues. Training for us, we actually contracted with a local firm here in Baton Rouge, Louisiana, that put together an online-based training, and they also have a LIMS program, learning management tool that keeps track of everybody that takes part in that training. It prevented us from having to go out across the state and hold trainings in person, so everything is done online virtually now. And then we had to get the user buy-in. Some of the kickbacks that we probably would see with sheriff's offices, PD, police departments, they were probably the most resistant to it at first. It's just because that's just additional steps they have to take in their processes. The sexual assault nurse examiners, they were more excited about it because they're more the advocates for the survivors. So they want to see this more than anybody. So again, that timeline, it was really hard. And the reason why it was really hard is because of the software options. We had off-the-shelf type software we could have purchased. There were two vendors that we looked at. And of those vendors, they basically gave us a timeline anywhere from 8 to 14 months to get it in place and customized. That put me going beyond that 1 year timeline. So that would have been a huge risk taking that. And again, I mentioned earlier, Microsoft being a partner with this because they came in and showed us Power Platforms, and the uniqueness of it was I had so many other ideas that I could use Power Platforms for besides just this sexual assault kid tracking program once it was explained to me. So from there, we took a chance, a big chance. But with the partnership between our personnel, our IT department, and Microsoft, we developed this software within 4 months. We sat in one room for a whole entire week and brainstormed and started developing with the low code, no code. And we had a majority, if you want to call it the guts, put together. It was just fine tuning things after that and then doing the work on the back end of getting everybody integrated into the system from there. So we took a huge chance and it paid off dividends for us because, knock on wood, since we implemented it, the software has been working flawlessly up to this point. We haven't had any issues yet. So that's kind of where we at with it. So again, Robert, thanks to you and your team for coming to help us out with that. So I mentioned that 1 year timeline. We actually beat that timeline by 1 month. We were ready to go by June 1st. That was including all the training, all the kits being issued, all the personnel being input into the system, and the software being functional. So that was a huge win for us. So where are we at right now? We have the program up and running for the last almost 3.5 months now. It's disheartening to see the amount of kids that's in there, which means that's how many survivors that are out there just within those 3.5 months. And I'll kind of show you the analytics in a second because it's going to play a huge part. Because part of the statute, the legislation, is that we have to report annually to legislation the number of kids collected, how many law enforcement agencies collected kids and holding on to the evidence, how many they submit to the crime labs, how many the labs process. So the whole analytic page to that. And just recently, we actually went in and created a Power BI analytics page. If you want to view live time, it's public facing. You can access it from the links on the page. So if you go to lsp.org and you look under our services tab, you'll see under our crime lab, we have the link that goes to it. And it's live real time right now. The number shown right there is probably from a few days ago. It's probably going up a little bit more, which again, like I said, is disheartening that there's that many that come out in the last few months. But the analytics that we were building off of this kind of be more accurate. You know, our original estimate, because of this report that was done by the different state agency, we were estimating roughly 12 to 1,300 kids per year. Off the numbers that we have now, we're looking at anywhere around 16 to 1,700 kids per year. That's a huge difference for us. But with this, I'll be able to take and monitor, you know, how many is being submitted to the labs, what labs are actually getting them. Us, as you see on this graph right here, the State Police Crime Lab, of the date of this screenshot, we had 182 that were submitted to us, and the numbers for the other labs are a lot lesser. So, you know, we're processing probably half of the kits that are collected on an annual basis in Louisiana. So from there, we will actually get into another computer and we'll show you our demo site. And just this simplistic basis of what we do here with this. And so while Carrie's setting it up, do we have any questions?
There's a couple questions in the chat, Chad. Can you share who provided the training? I guess that's the only question I see so far.
Yeah, I'll
The-
type that back into the chat. But Learning Sciences? Learning Sciences is a local Baton Rouge company, and we contract with them for various projects in Louisiana. Our Louisiana Post, they actually do one. What else we have? Like we have an e-citation program. We have a crash database system that's actually statewide that they actually do as well. Carrie, to get hers up and running, she'll show you the demo. Sure, Sharon's Carrie.
Is yours the one on the right? Right, yeah. Need to mute Chad's.
Hey, Chad, is someone talking? If so, we're not hearing any feedback.
Can you hear me now, Rob?
I can hear you now.
So you sharing your screen or you can go away. So this is the survivor portal. Again, like I was trying to explain earlier, there's no public identifiable information on there. They're provided a kit number, and that kit number is just input into the system that shows the status of the tracking of it. So if you hit the search button again, it would just show them where it's at in the process. Again, the first little icon, that's the medical facility. Second one's law enforcement agency. The third one's the crime lab. Once it's done at the crime labs, because that kit has not been returned back to the law enforcement agency or the report's not done, the other icons would be taken grayed out until it transfers to the next part of the process. It highlights in the dark blue. That is real simplistic on that side. So that's the first portal, survivor portal. Then we have on the other side, we have our portal for the users. And this is where all of our kits are tracked on the back end. The same personnel, law enforcement, the crime labs, they all log into the user accounts. And from there is where they check out a kit. They show where it was checked out at with medical facility. From that medical facility, it goes through the process again down the chain through law enforcement and crime lab. So it shows the status of unfinished kits, meaning one's been checked out and that the kit is in the process. We have unreported cases. So in Louisiana, we have two types of cases. We have reported versus unreported. A kit can be collected and it can be determined to be unreported. And that means that the victim or survivor does not want to pursue criminal proceedings against the suspect, whether the suspect is known or unknown. A kit is still collected. Some new statutes in Louisiana changed from where law enforcement for unreported cases has to hold on to that kit for 20 years now. So they have 20 years to basically go back and change their mind on that, if they want to change it to reported.
They are internal.
So, just trying to think where to go from here with this. So it's just so much on the back end that they're keeping track of. On a daily basis, we may get agencies calling saying, hey, I entered the wrong kit number. Because of the easy use of the program, they're able to go in and actually make those changes. They may have put the wrong location that was collected. They can go and make those changes. We want to kind of control those things on the back end. That way it's a little bit more accurate on the data. And like even for the reported versus unreported that we're talking about, I don't want to give access to law enforcement agencies to change the status to reported to unreported freely, because I don't want to say it's corruption or anything like that. It's just that we want to see the accuracy of it. We want to make sure that the victim, the survivor, said they want to change the status of it. So they got to provide some type of documentation to us so we can actually make those changes. Because like recently we had a kit submitted to our crime lab here. It was basically an unreported case because there's documentation added to the submission here that survivor didn't want to do anything with it. It's just they still want to submit it to our lab so we can have it in our custody. We refuse that and reject that from coming in. Anything else, ladies, I'm missing?
Did they see the dashboard, or did they hear that part?
So, yeah, this is just more.
Yeah, we didn't hear that part. Go ahead.
So the dashboard is the analytics that we created. We can track it by HC, by crime lab. It's public facing. And we can sit there and drill down on who collected the kits, what medical facility or what law enforcement agency, what crime lab is it at. So like, for example, if you hit the crime lab tab, there it shows how many kits are at our crime lab for the Louisiana State Police, how many are at Acadiana, the Jefferson Parish, so on and so forth. We don't have a statewide system of crime labs here. We have one state police crime lab, and the rest are other owned by parishes or commissions, as they call them. and or police departments. So we track theirs as well. This will give us a little bit more data on the accuracy of it. And I think, like, my screenshot that I had in my PowerPoint, it was 431 cases collected, and now we're at 448, and that's just 2 days old. Yeah, somebody put that O face up there. I was like, yes, it's disheartening how many we collect. Do you store the written documents with the kid? So the kit, yes, the documents that are collected. So there's going to be a whole bunch of documentation inside the kits. We have, like I mentioned earlier, a standardized kit for adults and juveniles all in one. So as they collect the documents from the survivor, they put it into the kit and submit it to the labs when it comes here. That way, because there's things that we want at the crime lab, such as the scenario from the agency, so we can actually determine what evidence is actually most probative or probative to go into the analysis, because we try to pick what's going to be, we feel is going to yield the actual results versus just testing everything. Here in Louisiana, we do have a huge backlog on sexual assault kits. We're trying to come from under that right now. I'm trying to think the number of sexual assault kits offhand that we just outsourced just to get from under that. But this is going to hold us more accountable and more transparent on that process. So, any questions? It's not. I see a hand.
Yeah. DeAndre, if you want to come off mute and ask your question.
Yes. The documents I was referring to when you were saying that you get the written notice of changing it from reported to non-reported or vice versa, do you store those with the kits also, so that you have that there in case somebody comes back and was like, why did this get switched over?
No, we have two options. We can just keep it in the email format, or in our case management system here at the lab. If it's at our lab, we can drop it in as a correspondence into the system. So this is all still a lot of work in progress on some of the procedures. Again, we're 3-4 months into this right now, and there's some little nuances that do come up on different procedures. Because some things that we didn't realize early on was some of the coroner's offices here in Louisiana would hold on to their kits that were unreported versus turning them over to law enforcement. Some recent statutes just actually changed a lot of that, where they have to turn them over. We had some agencies that didn't really want to cross their jurisdictional boundaries to go somewhere and pick up kits. So those are things that just trying to rectify with all that to make sure it's all done in accordance with the statute. Some features I didn't mention is that we built in automatic notifications in this because of timelines that's in a statute. So we have in Louisiana, from the time a kit is collected by the medical facility, law enforcement has 72 hours to pick up the kit. And then after that, they have 10 days to get it to the crime lab. It was 30 days and it just changed to 10. But there's an automatic notification if a crime lab doesn't receive it, or if the law enforcement doesn't pick it up from the sane personnel, it sends whoever their coordinator is, their administrator for their accounts. It sends them an email saying, you have a kit waiting to be collected at the medical facility, or you have a kit that is due to the crime lab.
I had another question. Does your system also cover occurrences in the prisons or jails also?
Yes, all that would be, if the kit is collected, they'll take and submit all that to us. And so that's where we track it from. I think we've had 1 or 2 come in from our Department of Corrections.
Do we have
So,
any
like,
more
obviously-
questions? All right, go ahead. Captain.
Say, just our system does mandate that every law enforcement agency in the state participate, every medical facility. And that is one thing that, speaking with the senator recently, she wants everybody, make sure that they participate and wants to know who is not. And then she's actually pursuing additional amendments to her statute to have the prosecution actually participate.
So this is DeAndre Francis again. I have another question. How hard was it for your immediate staff to adopt into the new system? Did they like the way that it seemed to make stuff a little bit easier and like the workflow process?
Yeah, it's a lot easier. I mean, it's very user friendly. Everyone that participates in it says how easy it is to use and figure out, even if you don't know anything about it.
So the oversight committee I mentioned earlier, we meet once every 6 months. And in the first meeting, it was live for just a few weeks, maybe a month. And they were all super excited on how easy it was to use on the front end. And then on the back end here, at least they haven't complained to me. So we're good.
Captain Guidry, it's Jeff. One thing I thought it may be interesting too to some of the guys, can you go over how you guys are registering the users and giving access to the portal?
What do y'all want?
Yeah, so we have a training course that we created, and once the user takes the training course, we go in and see who's taken it, and then we can add them into the tracking system, or they can submit a portal access request. And basically we get a notification, we have to go in and approve their account. So not just anyone can randomly join the tracking system.
Yep. Yeah, I've
Some
used
things
that
that-
as an example with different agencies. That's why I was wanting to get you to talk about it, you know, Captain Guidry, because it really was, because they've got to pass some kind of certification training and stuff like that, right? And then
Yeah, so they're required to take the training course before we can add them to the system as a user.
And we're able to take the training course and break it down, one for medical facilities, one for law enforcement, and one for the labs. That way they didn't have to sit through all of it. So we broke it down into the 3 phases. That way it's a little easier and less on time. And there's no tests or anything to it. It's just ensuring that they go through it to see what the processes are and what are their requirements. And just their learning sciences, learning management system keeps a record of everything for us. So if we need to do an audit at any point, we can go and request it from them. They'll give us the access and let us know who actually took it, dates, times, whatever. And did we build in inactivity? You don't use it for so much time you're inactive.
I don't think we did. It shows if they didn't complete, if they started the training but didn't complete it, but it doesn't show time.
Talk to Eugene about that.
I know we had some discussion, like if they were inactive for 6 months or a year, as far as the users, it automatically would take and basically expire them. And if they wanted access, they would have to go back and redo the training. And because they've been out of the system for so long, there may be some updates that we make or something like that. And we want to make sure everybody gets it.
So you guys are using workflows behind the scenes to help maintain your user database?
Yes, sir. And a lot of that stuff on the back end, as far as how the workflows were set up, that was that partnership that we had with OTS, Office Technology Services. We do have one person in-house that has become very versed in Power App platform. But we also did a staff aug through our Office Technology Services to help us finish off the project. You know, my in-house IT person, we have him doing a lot of other projects, working on our CODIS instruments and stuff like that, Rapid DNA right now. So his time was kind of limited. So we had to do a staff aug with this as well. And it's been so successful that we're actually taking and making a call lesser version of this. So we've been mandated to do the sexual assault kit tracking, but prior to all this, the Louisiana State Police Crime Lab actually provided all the blood or toxicology kits for all the agencies across the state. So if you were involved in a fatal crash and we had to actually draw blood because of you're required in all fatal crashes here to do that, or if you refuse to provide a breath sample, we can get a warrant for your blood for toxicology purposes, DWI. So we had those blood kits in Louisiana and we supply those. Well, we were having inventory issues because agencies would come and get them, but not use them all, but come get more. And so we're running short. So we're actually right now currently working on a tracking system for that. That won't be as easy or mandated for the crime labs to participate. We just want to really, it's inventory tracking simplified to make sure we know who's taking them, when they're taking them, are we shipping, whatever it may be.
So are you guys using a barcode to track the kits? And then are you scanning those with a scanner or inputting them manually?
They're inputted manually.
So we did like a batch upload of the kit all at one time, and then we assign them to different regions. And then once the nurse enters the kit, they just input the kit number in there.
So we have a question, which identity providers or provider are using staff portal? If I understand the question, we're using just their email address that they provide to us. So whenever they're admin or they actually want to do a self-registration, they provide that, they provide the emails, and that's what we put into the system. So when we do track on the back end through the user portal, we do track the agency, the name of the investigator or patrolman or patrolwoman who picked up the kit from the same personnel. We do track what SANE examiner was the collector of the kit. So we do track that information. That is not PII information. That is actually public record because it's part of that report. We do track the agency case number because most of the crime labs here in Louisiana create their own, if you want to call it, item number for their labs. So we do track both into the system as well.
The system looks great, especially for just 4 months of brainstorming and putting it together. Do you guys connect to any other databases or other types of information, pull in additional information from other, or basically I'm trying to say, are you pulling in any additional information or data from other types of sources, data sources?
So one thing we're trying right now, and it's a hard process. Just about all the crime labs here in Louisiana utilize for their LIMS system. It's now on the Versa term. It's Justice Tracks. Justice Tracks for us was on-prem. We just switched to a cloud hosted, and the API access is not as easy or robust. So that is one thing we're looking for a future build is adding APIs to where the labs themselves can go into their own LIMS system, show the kit was received, and it automatically changes the status in the program, the tracking program. That because right now they're having to log into both and
Gotcha. Yeah, I could see them being a little upset about that. Yeah, that'll definitely make you guys make the adoption way easier by being able to just put it in one time and all the information flow over.
yeah, it's that. I'd like to see that, and then even the report. Once the report is done, if it can actually upload a copy into the user portal and attaches it to that case, that'd be amazing as well, because that's things where we can track the statuses more easier and better when it comes to when we get the prosecutors on board.
So currently, are you guys storing all the information in Dataverse or are you storing it in SharePoint?
Jeff, you may be able to help us with that answer. I think it's all
Dataverse.
going to Dataverse.
Yeah, so
Okay.
the kit and all is tracking. I think there is a push for the survivor information over into SQL, DeAndre, for their survivor portal piece of it. But the main part you showed earlier is all Dataverse and, you know, Power Pages front end. So,
Right. Gotcha. Yeah,
I have a
I really
question.
like
If
this
DeAndre's
product.
done.
Yes, I'm done. I'm sorry.
Oh, sure, sure. I put half my question in the chat there, so you can ignore that. Does the word you mentioned staff portal, is all staff a state employee? And the second part of that question is which identity providers are you using for that portal?
So, if I'm understanding right, so we have the survivor portal and we have a user portal.
Mhm.
And the user portal is all the agencies and same personnel and crime labs that are users of that. But then we have the admin login, which is the ladies here. They'll go in and they see a whole different view from their side.
Right,
Yeah,
right.
so-
Not the
so-
Power App, which is the last thing you showed us, but the second
Mm.
portal, the user portal. Sorry, I wrote it down as staff portal. Is that only being accessed by state employees?
So that is being accessed by every law enforcement agency in the state, which can be a sheriff's office or police department,
Okay.
college campus police. That they're all their own entities. Same thing with the same personnel. Those are not state workers. Those are employees of the hospitals, the coroner's offices. So a lot of them. Some of the nuances we had with that is a same personnel is not or may not be assigned to just one hospital. They may cover 3 or 4 different hospitals.
Okay.
So,
So with the idea that they're not all state employees, you're probably not using their Active Directory account to
No.
log them
No.
into the portal. Are you using local or are you using an external identity provider?
It's local, Jared. Sorry.
Thank you.
Yeah. That's where they've got the checks and balances in there too. With like I was talking about earlier, like if you go on the you can request access. I also think, if I remember correctly, Captain Guidry and team, the admin at the facilities could manage who was accessing from their team and all as well.
Yes.
Yeah. So it's like anybody can kind of request access, Jared, but there's an approval process where they made sure the training was there and all that, and then what role you need, and based on the role you got, you would see different parts of the portal.
Yeah.
Can you show us what that approval process looks like, or what the staff view of it looks like?
So, we have a section called portal access requests. And
Okay. Can you share your screen and show it, or is it proprietary here?
that was good. Just trying to get there.
I'm here to ask you all the weird questions. Sorry.
No, we're good. Can you see it now?
we have a section
Okay.
called portal access. And if an administrator adds a user for their agency, it pops up here. And we'll just go in and edit, and we'll select it as approved once we make sure they take their training.
And then that sends them an invitation, Jared, to the portal.
Okay.
If I
There's
remember
the
correct,
training
that's what we worked
completion
on.
date.
Yeah.
Okay.
Yeah.
All right. Thank you.
Hi, this is DeAndre again. So while we're here, does this show you, do you guys like have a workflow built into this portion here that shows you stuff along the way here? Because I know there's like a workflow view of things in the Dataverse portion. So I was just curious if you had that back here, or it was just through the Power Automates.
On that homepage, don't we usually have like charts and stuff?
Yeah,
But
we have
those-
like this kind of dashboard or
So we have our own dashboard, and then we're also able to check on the status of each kit. We can select the kit itself, and then we can see exactly where it's at throughout the process. Not sure if that's what.
Okay, cool.
And the good part is, you know, when we actually developed this, we did a whole testing site and we still have that up and running, which I think this is what you're seeing
Yeah,
right now
this
is
is
the
the-
test view. While we still, and so if there's any changes we want to make, we'll make it on the test, try it out, and then we can actually implement it into the live site.
We're running close to the top of the hour. Any other questions before we wrap up? I think this is a great presentation so far. Really engaging. A lot of good questions. Any other questions while we have Captain Guidry and the Louisiana State Police Crime Lab team on the call?
I'm good. I would definitely like to, if they don't mind, keep us up to date as they go through and fine tune it and, add more functionality and things like that. That would be great.
Yeah.
No, definitely. I think somebody asked about earlier the barcodes. Our kits do have barcodes to them, if I'm not mistaken. They would get that.
Yes, they do.
So there's barcodes to them, and we do have the option later on to develop where we do barcode scanners. It's just getting to that point. A lot of it comes into play. Do we have to supply all the barcode scanners, and how many do we need across the state? So now we got to start diving into all that. But there are future options for that as well. I'd really like to see, can they use a mobile app to actually do the scanning? Those are some of the future developments that we'd like to see at some point.
I can answer that question for you. Yes, you can. I actually have an inventory app that I've been developing with a Microsoft engineer, so that we can limit people entering serial numbers by hand. But the plan is to have the desktop technicians, when they take a laptop out to deploy it, they scan the serial number, it finds a serial number in the list, and then they can type in the staff name and assign the laptop to them right then and there. So yeah, you can use a cell phone to scan a barcode through the Power Platform. So
Nice.
that was one of the reasons why I was asking you, like, are you guys typing in? Or you scan the barcode? But then when you answered, I was like, oh yeah, everybody's got to have a scanner of some type. So like you said,
Yeah.
do you guys supply them or what? But yeah, if you can get it to where you can use a cell phone, then you don't have to supply a scanner. They can just use any cell phone that pulls up the Power app to scan it and go from there.
Some of those issues that I foresee, because we have it internally as well, is when you ask people to use their personal phones for stuff like that, they're a little apprehensive about it. So it's
Yeah.
just getting past those fears, that no, your phone won't be subpoenaed or anything like that. No records kept on your phone or anything. So those are some of the things we have to get into their minds.
Yeah, you can just let them know that the Power apps the data is being stored in the cloud, not on your phone.
Yep.
So that's one way to kind of sell them on it, with the way the Power apps is written and the Power and all that good stuff. So yeah.
Well, we
Cool. Yeah,
just
I'm looking forward
transitioned
to
it.
the updates.
We just transitioned to Teams as an agency 6 months ago, and we love it. There's a whole bunch of things that came with it with 365 and everything, the automate and a whole bunch of things that we're diving into now. We love it. I have people here that does not want to download Teams to their phones. It's just their personal phone. It's like it's amazing. So
Well, just to let you know, if you didn't know already, there is a walkie-talkie feature through Teams that you could use. So that might spur them on a little bit.
no, because they don't want me having access to them. So
But yeah, I'm looking forward to you guys developing this and fine tuning it more. I might be able to see if bring it to North Carolina, which is where I'm at.
okay, yeah. I know it's gonna be a huge push because even through some of the grants out there, SAKT grant, a few things that come out every year, there's funding for these programs. So if North Carolina doesn't have it yet, they can apply for the SAKT grant when it comes out. It won't be until next September, but they can definitely get funding for it.
Sounds good. Thanks a lot. Appreciate that information.
I think the last second grant we just applied for, max was like 1.5 million.
Mhm.
So it's a huge grant. And for this purpose, they were most likely awarded.
Could you post the name of that grant in the chat? That way I won't lose it.
Well, this has been a hugely impactful and very relevant, interesting use case. Thank you so much, Louisiana State Police team, for carving out some time and sharing best practices. Thank you everyone for joining um, on the Microsoft side and all the customers also from a customer perspective. But I appreciate you all. And if is there any last minute questions or comments or concerns? Also, just to know that the recording will be on our Dynamics user group community. So if you want to go back and rewatch it, the webinar or share with any of your peers, please feel free to download it from YouTube, and you can share it from there. But I thank you all, and thank you all again. Huge round of applause to Louisiana State Police Crime Lab team for being able to share and taking the time to present this. As we all know, this is a very impactful use case and that solved a very real issue. So I appreciate you all.
No, thanks for getting us on here, Rob, and allow us to show what we've done with you all as well. If anybody needs to contact us through our site, lsp.org, there's a email address for crimelab@la.gov. You can contact us through that email address if you have any more questions.
Well, thank you all. This is an engaging presentation, and I look forward to the next one. Appreciate you all. Thank you all.
Thank you, guys.